Let's bring in Anne Rimoin, professor of epidemiology at the UCLA Fielding School of Public Health. So welcome to Anne. And as we have been reporting, American passengers will be heading to a quarantine facility in Nebraska. But the health officials say they may not be facing a mandatory quarantine, just monitoring about 42 days. Can you explain the justification behind a decision like this? Is it safe?
Well, thanks for having me, Alex. And I think what's happening right now is that those passengers are going to get to Nebraska, which is this national quarantine unit, which has really been built specifically for this purpose, to be able to quarantine and isolate people who've been exposed to an important pathogen like this and be able to provide care. They're going to do a risk assessment. That's what we've heard. That's very, very important because not everybody is going to have the exact same risks of exposure to this pathogen on that ship. And then they will work with them to figure out, well, can they effectively quarantine at home? Do they have all of the logistics to be able to do so? Do they live in a multi-generational household? Are they responsible for care for other people? How exactly is this going to work? So the likely scenario is that they're going to work out those details, do a risk-based strategy, and then determine what's possible for that person based on that, knowing that we do have the capacity to quarantine them at this place if needed.
So right now, countries are racing to monitor people who were previously on that ship or in contact with sick passengers. What does it look like to monitor such a large volume of people? I mean, how long could this process last?
Well, we've seen monitoring of people exposed to dangerous pathogens before. We've seen this with Ebola. We've seen this certainly with COVID-19. We've seen it with many pathogens before. So this is a standard public health protocol to do so. People check in daily with their local public health authorities to in terms of symptoms and fever, other things that they're looking for specifically as it relates to hantavirus. And it's over the period of incubation from the time that they're exposed to the time when symptoms would potentially occur. And so that here is around 42 days. And so that's what's going to happen during this time period until they're out of the clear.
So the World Health Organization, as you know, is predicting a limited spread of the virus if public health measures are enacted. But first of all, how limited is limited? Is it any cause to worry?
Well, I think it's important here to remember that this is not, just binary. It's not, is this serious and is it not serious? And serious doesn't always mean pandemic threat. So this is a very serious disease. It's deadly. And we know that it is spread person to person. We've had the big organization, the International Hantavirus Society, really tell us what they know about it. Always important to ask the people who've been working on this virus for a long time. And we do know that it can spread from person to person, that, there is some incubation period, and, that spread from person to person can happen, mostly with close contact, but defining that close contact is going to be critical. We can absolutely contain this thing. We know that there's a long incubation period that actually works in our favor because these people have mostly been contained on a ship. We know most of the flight manifests. We know how to get in touch with people who've been closely associated. So I think risk to the public is low. Risk to those people who've been directly in contact with cases is very high.
And frankly, multiple officials and medical experts have cautioned against panicking. They're assuring people this is not another COVID pandemic. Take a listen.
The key message I want to send to your audience is that this is not COVID. This is not going to lead to the kind of outbreak.
I do understand that this is not a respiratory disease, meaning it's very difficult, if impossible, to pass through coughing or breathing. It's very rare to see it transmitted between humans.
And so far, people in several countries are being tested or monitored after possibly being in contact with that virus. So the French prime minister has just said one of the 5 French passengers showed symptoms during a repatriation flight. So how different is this than COVID? And is there an advantage to knowing how to identify hantavirus at this early stage compared to, say, the early days of COVID when it was virtually unknown?
Well, Alex, you hit on the most important point here. When we dealt with COVID, we had a completely novel pathogen, something we'd never seen before. We didn't have diagnostics. We didn't really know anything about incubation period. We didn't know anything about symptoms. We didn't really understand how it spread. So we started from zero. This is not the case. We know something about this pathogen. Could we learn more? Absolutely. But do we have the tools to be able to contain it and get in front of it? Yes, we do. So I think that, again, it's important to remember it can be low risk for the general public, not necessarily a pandemic risk, but a very serious public health issue that needs to be addressed, and to throw all the tools that we have at it to keep it contained.
All right. I thank you, Anne Rimoin, for your expertise and weighing in and calming down anybody who might be a little concerned. Appreciate all that.